Hello, everyone, and welcome to Hidden Health, the Harvard Public Health Review podcast, where we talk about different aspects of public health that are often overlooked or not given as much attention as they should be. So today I have three students from the Harvard Public Health Chan School who are here to talk about their careers in public health and what their education has looked like. So without further ado, I'll let them introduce themselves. Ruhi, would you like to go first?
Sure. Hi, everyone. My name is Ruhi. I am currently based out of California. I just graduated from the NPH 65 program in health management at the Harvard Chan School, and my primary interest is in health equity. I'll pass it off to Cindy.
Hi everyone, I'm Cindy. I am a second year MPH student, MPH 65 in health and social behavior at the Social and Behavioral Sciences Department. And I'm generally interested in mental health among Asian populations.
All right, I'll go next. I'm Ellen. I'm a rising second year PhD student in the biostatistics department. And within that, my research focus is on environmental health. And thus far, it's mostly been air pollution epidemiology. So yeah, I should also mention, I just moved to Boston from Colorado, and that's where I grew up and did my undergrad. So happy to be here.
Wonderful. And just for the context, I might be jumping in as a student side as well, because I also just graduated from my MPH 65 in the global health department. And like Ruhi, I think I have a lot of interest, but I think it comes down to health equity, health disparities, things around that is my sort of niche in public health. So to get us started, let's hear a little bit more about your path to studying public health at Harvard. What was your concept of what public health was coming in? Why were you interested in exploring it here? What did you think you were going to get out of the whole experience? Let's start with Ellen this time.
Okay. I don't know how traditional my path was, maybe there is no traditional path into public health. I studied applied math in undergrad and was interested in that as kind of just a general technical toolbox for answering various questions. Have always been interested in environmental science and policy. And then in my first couple of years of undergrad, had this kind of growing understanding of just the connections between environmental science with social and economic inequality. And then I began doing research with a professor who was looking at the health impacts of air pollution, and that kind of cemented my feeling that, oh, public health is this intersection of, environmental science, economic, social inequity, and just the kind of more I saw, the more I realized that it was a really, great place that I could continue kind of exploring all of these interests and trying to find something that fit for me. Yeah, I'll pass it off to Ruhi.
Yeah, definitely. I was actually pre-med for a long time, from high school through junior year in college. And then I realized through taking some public health classes in college that the type of impact I was looking to make didn't mean that I had to have an MD. And I think through that experience, I realized like, hey, what I'm actually looking for is more public health than it is going through the pre-med route. So I did study public health in undergrad. I did come in knowing that I wanted to study public health. I was always sort of interested in that. My mom has always worked in public health, so I think that comes from there. But junior year, I decided to switch from the pre-med route and kind of consider doing an MPH eventually. So post-grad from college, I worked at the county level at a health department through a CDC fellowship. So I got a lot of experience kind of health education wise and doing a lot of community-based field work, which was really interesting. And I also worked for a few years as a research coordinator at a large tertiary care hospital. So those experiences combined, essentially, after working for a few years, I decided, okay, now I'm ready to do my MPH. But I feel like it took deciding, even though I knew I wanted to get an MPH eventually, it took speaking to a lot of students who had gotten an MPH, where they'd gotten it from, to sort of narrow down where I wanted to apply, and to sort of my decision to eventually decide on Harvard, or even to apply to Harvard. It took talking to a lot of different folks, and deciding that this is what I wanted to study. I think choosing health management specifically comes from deciding that what I wanted to do with the degree post grad was essentially move from more of a clinical role, which I was in, to the more nonprofit and social impact space. And what I found is that in nonprofit, there's no dearth of people who are always passionate about public health. In public health, we have so many people who are dedicated to the cause, but there's just a challenge always of funding. And what I find is, if my thought before going to school was, if we could run nonprofits or organizations a little more like for-profit entities, and kind of maximize or optimize the way that we use those funding dollars, we could kind of also optimize the impact that we have from these organizations. And so I didn't come in with any of those technical skills in finance, which is what the health management track at Harvard offers. A lot of technical skills in accounting and finance, and kind of managing budgets and things like that. So that's what I was looking for through the program, to kind of be able to meet this end goal of managing an organization a little better, to achieve greater impact. Because I feel like nonprofits are always just fighting for survival when they're making so much good, and really shouldn't be the case. Yeah, I'll pass it off to Cindy.
So for me, I did my undergrad studying public health, but I also, just like Ruhi, was pre-med at first. I think during my first year, I kind of realized it was very course-based, but I did not want to spend my entire next 9 years of my life taking biology and chemistry courses. It just was not my cup of tea. So I started delving into more of the mental health space, and realized this is where I fit in the most, from personal experiences and also just interpersonal talking to professors and students just like myself. So I think that's where I kind of realized mental health doesn't have to be I don't have to be a clinician. I don't have to be a therapist or a psychiatrist to work in this space. I can also apply public health to it. So I think that's when I just started wanting to I started having very vague ideas of, oh, I really wanted to implement and create interventions. Just the idea of that was just so aspirational to me, I guess, because especially coming from an Asian background, mental health is very stigmatized. So I realized there wasn't really organizations out there that was very culturally sensitive and tailored to my specific population. Yeah, so after that, after graduating, I worked at the American Red Cross, kind of deviating from the mental health, but really learned about emergency response, humanitarian crises, and all of that. It was a great experience. I worked a lot with lower or low socioeconomic populations. The conversations were great. It showed how important community engagement was, especially in public health, and really being able to identify in some way with the community. And just developing the trust with them. So that was a valuable experience, but I also ended up doing some research at the University of Southern California in mental health. And that's when I realized this is what I want to do. This is how I want to contribute to the space of public health, especially in a research topic that's very underfunded and not very not studied very well in our space. So yeah, that's me.